for members to have one location where there could be copies of this 1,990-page Pelosi healthcare plan, and where there would also be resources being provided by conference and also from individual members about the contents of this bill. We just received word that our Democrat colleagues have launched their own reading room, and we applaud that. We think members of Congress ought to take every opportunity to understand what's in the Pelosi healthcare plan, and when they do, we believe it will become obvious that this is nothing more than a government takeover of healthcare. The Pelosi healthcare plan includes 43 entitlement programs that the bill creates, expands, or extends, 111 additional offices, bureaus, commissions, programs, and bureaucracies. And what we found so far is that the mandatory legal word shall, which mandates individuals and businesses and bureaucracies to take action, actually appears in this legislation 3,425 times. That's just for starters, and the Republicans are committed to doing the people's work, to understanding as members of Congress firsthand what's in this bill, and taking every opportunity between now and when this bill or some iteration of it would come to the floor to make sure the American people understand exactly what the Pelosi healthcare plan will mean for them and their families and their businesses. We're joined by some of our leading lights on healthcare reform in the Congress. Roy Blunt is not only the former Republican majority leader, but he was tapped in this Congress by Republican leader Boehner to lead the Healthcare Solutions Group, and he's helping us to inaugurate our reading room. Mr. Blunt, welcome.
Well, thank you, Mike. And this is a place where members can come and look through the bill. They can look through the bill other places as well. But this room where members can come, look through the bill, talk about what's in there, and talk about how we respond to that. Frankly, in this legislation, the facts will be the friends of the opposition of this, and they'll also lead to a clear understanding that there are lots of reforms that could be made in this system that don't take 1,990 pages, that don't cost $1 trillion, that aren't on the backs of cutting Medicare services by $500 billion, and don't create all kinds of new government mandates. When you say a shall in a 1,990-page bill 3,425 times, obviously the government is moving in a direction that doesn't leave a lot of flexibility. Our Healthcare Solutions Group has had good ideas out there. We've been particularly benefited by having Republican doctors on the floor in the Healthcare Solutions Group with our conference, leading this fight and helping lead this fight and serving as a great resource. And Dr. Burgess, I think the idea for this reading room was an idea that you came up with. Having doctors here as a resource is important, and you might want to talk about that a little bit.
Well, actually, this is now the third collection in this room this week. We had one last night after votes. Dennis Smith came over from Heritage Foundation talking about the Medicaid parts that are in this bill. We learned some interesting things. During his discussion this morning, Dr. Doug Holtz-Eakin from the Manhattan Institute was with us, former director of the Congressional Budget Office, and shared some interesting facts with us, one of which, and I frankly had not known this before, but 87% of the taxes in this bill will be borne by individuals who earn under $200,000 a year. So clearly it puts at issue the concept that this is not going to be a tax on the middle class. Clearly, this bill is going to be paid for by a tax on the middle class. You know, I guess the biggest thing to me is, we heard from the President 5-6 weeks ago that we can pass this bill and not add one dime to the deficit, build a new entitlement program and not add one dime to the deficit. The American people don't believe that. That's sheer fantasy. And now the question to us is, if we're asked to believe that, then what else have you hidden in these pages? The fact is, none of us around this table, all who are interested in healthcare policy, for us this is not spin that's not a soundbite. We're interested in healthcare policy. We want to help formulate and drive healthcare policy, but none of us around this table were ever asked to be part of the group that drafted these bills that came up with all of this legislative language. Mr. Blunt is correct. We have had a solutions group working since the first of the year. We have come up with some good alternatives to some of the things that are proposed here. My read on this summer's events was the American people don't like 1,000-page bills. I gotta believe they're not going to be thrilled with a 2,000-page bill. When we do big things like this, the law of unintended consequences gets hit with an accelerant that really magnifies any of the decisions that are made in language like this. So that's what members are here for today. We're here to listen and learn from each other. We will have other collections up here tomorrow. We're going to hear from someone from Center for Health Transformations on the Medicare part of this bill. And we just need to spend our time wisely this week. Our obligation now, we didn't get to write the bill, we didn't get to be responsible for the policy, but to responsibly address the policy, we must know what's contained within the bill.
Thank you, Dr. Burgess. I'm going to recognize members down the line, beginning with the former chairman of the House Republican Conference, Adam Putnam. But let me say to members in the Fourth Estate who are here, this room is open to members. You're going to see a very informal dialogue taking place as members are going through the legislation over the coming hours and days. And in the spirit of transparency, this room will be open to the press, so that as members of the press are trying to get their arms around this legislation, this room is going to be open to you on behalf of the American people. With that, former conference chairman Adam Putnam, the floor.
Thank you, Mr. Chairman. You know, in August, the American people had an opportunity to digest and debate what the House Bill 3200 did, and that House bill was about this big. And as a result, it was found to be a very unpopular idea and was rejected by most Americans throughout August. The Democratic leadership's response to an unpopular 1,000-page bill was to make it an unpopular 2,000-page bill. You know, in the last number of years, you can't find a comparable issue that has required this much verbosity with such radical changes to the relationship between the government and its people. And one of the most complicated things I can remember doing in my 10 years here is when we created the Department of Homeland Security. That required about 187 pages to accomplish. The U.S. Constitution required about 8.5 by 11 pages to accomplish. And so it's not just about how many pages are in this bill. It's about the fact that nobody, not even the people who have written it, understand exactly what's in this bill. And 72 hours to digest all of this, I think, is more than any of the American voters care to digest in terms of what it's going to impact in their life, in the form of higher taxes, fewer options, major cuts to nursing homes, to home health care providers, and as many as 111 new federal bureaucracies that are being created to make all of this work. The Republican plan is more elegant and it is more simple. It is based on the principles that we are not going to expand the deficit. This bill is over $1 trillion. Our plan will not raise taxes on small businesses. Their plan will substantially raise taxes on small businesses to the tune of $800 billion. So I think that in this case, people understand that when government tries to shove something this big down their throats so quickly under such an arbitrary deadline, that it's the people who are going to feel the consequences of that haste.
We appreciate all the members that are here. I'm just going to ask the members to maybe give us a quick thought, beginning with Jeff Miller from Florida. And since I can't see that we have such a good turnout here, I can't see everybody down the line, just introduce yourself, your state, and give us a quick thought about why you're here at the reading room. And members will be coming and going through the day, and as we continue to have information flow into here, you'll see a changing of the guard. But Jeff, and on down, give us your thoughts if you're so inclined.
Thanks, Mike. I carried a copy of the bill with me home this weekend. I actually carried it on the airplane and then coming back to Washington yesterday. It's amazing the number of people that came up to me and said, "Is that the bill?" I mean, they obviously knew that this was Nancy Pelosi's healthcare takeover bill, and as I started through it, I got through this much over the weekend. I wanted to come in here and continue to read. Interestingly enough, I just hit page 1168. It's interesting that under the headline of health insurance in 4375, there's hereby imposed on each special health insurance policy for each policy year a fee equal to the fair share per capita amount determined under section 9511 multiplied by the average number of lives covered under the policy. Pretty clear. Then you go to B, liability for the fee. The fee imposed by subsection A shall be paid by the insurer of the policy. They may intend for it to be paid by the issuer of the policy. It's going to be paid by the policyholder. We are putting billions and billions of taxes upon the backs of small businesses at a time when they don't need it. I appreciate the conference putting this reading room together so we can come together and share ideas together.
Thank you, Jeff. On down the line, I think Mr. McCall.
Yeah, Michael McCall from Texas, 2,000 pages, written largely by staffers and lobbyists behind closed doors. Now went home to Texas Medical Center in Houston, met with some of the best healthcare professionals in the world, the president of MD Anderson Hospital, best cancer treatment in the world. And their answer was, why didn't Congress talk to us? Why didn't they talk to us? And then they said something else. They said, this bill with the public option will destroy American medicine as we know it. We have one of the best health care systems in the world. Why would the Congress do this? Those are the top experts. Those are the top experts who were not talked to when this bill was written. And I want to touch on a couple of provisions. One, the public option is still in this bill, and it's such a great idea for the American people. Then why did the members of Congress not put themselves on this bill? This bill does not require members of Congress to enroll in the government-run health care plan. Well, you know what? If Congress is going to pass this thing, I think they should be. And one other thing it does is a huge surtax of $500 billion, a surcharge on small businesses that, according to President Obama's own economic advisor, his model, will kill about 5.5 million jobs in this country at a time when our country can least afford it. We need to take a good hard look at this, and I appreciate the doctor for setting up the reading room. The devil's always in the details, and we're going to be reading that for quite some time. Thank you.
Adrian Smith from Nebraska. This is certainly a departure, I think, from what we need to be doing in terms of really opening up healthcare. I was kind of warned early on that we need to be careful and not negate Nebraska's medical liability policy already on the books. And yet, page 1432, section 2531 talks about incentive payments to states for enacting medical liability laws, but only if such laws don't limit attorneys' fees or impose caps on damages. And it certainly does. And this would negate a lot of progress that's been made, not only in Nebraska, but other states as well. And looking at the Health Choices Commissioner, it's certainly suspect when we have to put that in the bill. The job description of a Health Choices Commissioner, how much they're paid, and various other things. And I guess this is my green version of the bill here, since there's 4 pages to 1 sheet of paper. But there's a lot more reading to do here, and I think we need actually more than 72 hours to do this. So thank you very much.
Thanks, Adrian. Jim?
Thank you, Chairman. I want to thank Dr. Burgess for putting this together, too. Look, I'll just cut to the chase. Americans hate being told what to do. That's why we're Americans. We like choice, we like freedom, and the fact we've got 2,000 pages with all the shalls, all the mandates. I mean, most of you probably know the old line. For most Americans, when they're traveling down the highway and they see the sign that says 55, for most Americans, that's not the limit, that's the challenge. I mean, that's just the way we look at things. And here comes big government, Nancy Pelosi's plan, which says, here's how you're going to get your health care. Here's how you and your family are now going to have to interact with bureaucrats in the federal government. And it is just fundamentally wrong and fundamentally goes against the principles that make this country special. And so it's that reason why we need this going on and let the American people know exactly what's in this legislation. Thank you, Mr. Chairman.
Yeah, you bet. Dr. Cassidy, final thought, and then we'll maybe take a question or two and get down to our homework.
My name is Bill Cassidy. I'm a physician from Louisiana, and I've actually worked for the last 20 years in a hospital for the uninsured. I've worked in a safety net hospital addressing this issue from the trenches. I've learned there's three fundamentals to healthcare reform, and the President acknowledges them. You got to control cost in order to deliver quality care and make it accessible for all. Now, control cost is the issue. In my public hospital, at the end of the fiscal year, if we were out of money, we postponed procedures to the next fiscal year. It's amazing. I worked in a hospital in Los Angeles, a similar situation. So does this bill control cost? Now, by smoke and mirrors it appears, but it's very interesting. If you look at page 14 on the Congressional Budget Office analysis, on page 14, the CBO says, this bill assumes a rate of inflation of 4% for Medicare. In reality, historically, it's been 7%. And we're about to have more baby boomers than ever enter the Medicare population. Clearly, they have their tongue firmly in their cheek as they're attempting to say the presumptions of this bill are specious. Now, I think the Republican solutions actually work. If you look at the health savings accounts that we endorse, as an example, Kaiser Family Foundation, certainly not a right-wing conspiracy organization, says that health savings accounts are 30% cheaper for a family of four, and because they're cheaper, it expands access. 27% of the people who have them were previously uninsured. That said, I think that this solution is not a solution. It does not control costs. Inevitably, quality and access will suffer. On the other hand, the Republican solutions, consistent with ideas of personal responsibility, I think, frankly, are much better and have a much greater potential to help those patients whom I've been attempting to help for the last 20 years.
Why don't we take a couple of